color, which was originally like Indian skin, went back to pink, like a Chinese kind of like a color, and then she started to feel that the pain was going, and then by the end of the treatment, after 1 hour, the pain had disappeared, and the color came back. Although the skin was still very abnormal, and the skin was tight and peeling. She told me the next day the skin started to heal, and she had new skin growing from the creases of the fingers, which after a few days, new flesh was coming out. She said it's like baby skin. She was very happy, and then she went through further treatments without further problem in the hands. She had a couple of sessions, but then when she went on the chemotherapy again, it got better. She tolerated it much better. And some people gave up the chemotherapy because they could not tolerate the side effects.
Yeah, the chemotherapy is... Okay, so this is another example of, it's hard to see it on the I mean, obviously it looks much more darker here, and then there was an immediate effect on the pigmentation. Stretch marks. I only have one picture. I think we need a lot more pictures on stretch marks from Dr. Mark, that is our clinical research person. Now, there's a number of styles. However, this is something that we have seen very pronounced effect with the ileus, and that is a very big problem with women after pregnancy. If you do it immediately after the pregnancy, the stretch marks will go away. But if you wait for 10 years, it might be, well, the effect's going to be less. So the effect will depend on how long you have had the problem. Increased inflammatory energy, that's again with the special programs that were designed for Dr. Mark. And this is another patient of hers, so I'm going to pass the...
This patient of mine had an unknown diagnostic problem with all the doctors, that they didn't know why his neck was so swollen. It was not the thyroid, not the lymphatics, it was not the glandular fever, but he was ill for over 1 year with fever, restlessness, lethargy, breathlessness, could not breathe well. He couldn't understand. So when we had tried every way to make him feel more comfortable, he actually did some treatment on the other machine first to reset the body, just to tune the body a bit. But then after that, we would put this ileus, a couple of pads on each side of the neck, and the neck became more. After one session, he felt it was less tense. It was very tense. It was tight. The neck was very tight and swollen, and if you touch it, it was very hard. It softened up. It became less tense, and he was feeling much better. And he did about 3 or 4 sessions, 3 sessions. He just totally resolved. And he went back to his doctors at the X-ray hospitals, who were quite amazed, but he didn't dare tell them what he had done, because he couldn't really explain how it worked. He didn't say, you just got better. So, yeah. And he felt well in himself. With a combination of the 2 machines, he just got better.
Yeah. Yeah, we're going to talk about the second one, the Health Builder, that again, it's made there especially for Dr. Mark. That we're going to talk about it. So this is some other inflammatory conditions. That's one ileus treatment. That's another patient actually that we did in Dr. Kwok actually. You remember this patient, and I think you were there at that time. So there was immediate improvement with the ileus on her skin. And this is a study from Brazil. This lady had 6 treatments. This acne, she has had it all her life. And it was actually, it would get worse than this at times. And as you can see, it healed quite well after 6 treatments. So for cystic acne, you can also utilize this treatment, ileus. Now, varicose veins, we have a lot of clinical studies on that, but no pictures, unfortunately. But that's another indication for the ileus that can be used. And hair loss, we had only one study that basically increases the hair. We haven't had any more, but a lot of people have reported some kind of increase of hair. I guess you put it over there, and then I put it in my head. Yeah, shoot. A number of clinical studies have shown also significant reduction of pain, back pain. Actually, pain is a very fast healing problem with the ileus. And that's another study from Dr. Mark, another patient clinical study with acute back pain. Again, I'm gonna pass it on to her.
Right. This patient is actually my nurse's husband, who had he was lying in hospital for about 10 days with acute pain, and on MRI there was a documented cord compression or nerve compression, and he was told you have microsurgery or spinal surgery to relieve the pressure on the nerve, and he didn't want to have surgery, so he left the hospital in pain. And then asked me what I could do. And I said to him, well, maybe try this. I wasn't sure it would work because your condition seemed very severe and the doctor could not do anything and physio didn't help. And he came, and after one session, he could actually get himself off the bed, because before he couldn't get on the bed, but he could get off it and with ease. So my nurse was quite amazed, and then dragged him back to do it 10 more times on the next 10 days, even during the weekend. And he got better. He's walking around now. He doesn't need surgery. He's not. It's okay. But of course, he can come back. I said to him, you know, you have to be careful with your back. And if you feel some discomfort, maybe you should go back on the machine again. Because I was worried that when it becomes more sore, the symptoms would come back and we'll get worse. So it's quite surprising. I wasn't expecting it to work so well. After the first time, I was quite amazed.
Yeah, it does work on hair. Actually, the way I found that out is that when we first started the ileus, I had the prototype like in 2011, and we were in Italy, and I could not move. My back was hurting so bad, and I had to go to the trade show, and I was like, oh my God. So I said, just put the ileus there to see. I wasn't expecting anything, but you know, just let me see what happens. And like in 15 minutes, I had no pain. I was like, oh, this is really good. We have to look into more pain signals and kind of so. But that's how it started. Another patient of Dr. Mark. That's another medical condition. Dr. Mark has been using the devices primarily for medical conditions with some success, and I'm very impressed with the results, as a matter of fact. And I'm very impressed with her initiative, and she's a pioneer basically in this area. So I would like to pass it back to her. This is your patient again. Yes?
You know, I actually had it for my ankle because it was sprained, and I had gotten acupuncture. It was getting better, and then I got acupuncture. It got much worse, and then I came for treatment on my ankle, and then I was really good for a couple of weeks. It came back a little bit, but you know, it was great for a couple of weeks. It didn't bother me for a long time. So,
yeah, fair enough. That's a pain. Yeah, thank you, John. So tell us about this patient.
So this patient had documented 100% hearing loss in 1 year, and she's a government servant. And every time she gets stressed, her hearing was going down. So she worried about the other ear getting worse. So he was asking me what she was asking me what I could do. I said to her, I don't give it a try, you know. And then surprisingly, after one treatment, she was testing it. She was trying to see how much of volume she could turn on because she could hear on the radio. And before she could turn it up really high, she could not hear. But then after the treatment, she said she could turn it off, you know, fairly lower than what she normally has it on, and she could hear, started to hear so quite well. But then, of course, I mean, she came about 3 times, and she was getting progressively better. But then she was very busy; she couldn't take time off. So I'm just waiting to hear from her to see if we can come back and try further. And she should be having some hearing test maybe every year, and I would like to see whether she actually has documented.
Yeah, that's going to be interesting.
She hasn't had
I remember
done.
her.
Yeah.
I remember that we said, let's put her on the ileus and see what happens. Yeah. Okay, so now how it's done with these metal plates here that you put on the face and you just hold it. But what Dr. Mark has pads that puts on the body and holds it, you know, with the belt, and that's another way of basically performing it. So for different conditions, this is basically what you already saw. And what it looks like this. But we have another, this is what the Revive is going to look like. It's going to look like an iPad, and that's coming very, very soon. Hopefully by the end of this month, maybe the middle of October. Okay, now let's talk about how does Aelios do that. Can you unboil an egg? What do you think? Can you unboil an egg? And the answer is yes, you can. And there is a study that was made that you can basically unboil an egg by refolding the misfolded proteins of the egg. So you can actually unboil an egg, and primarily what you want to do is you want to turn nonsense proteins are going to be disease and aging. You want to turn them into meaningful signals, which is health and anti-aging, and you want to have misfolded proteins that again is disease and aging into folded proteins that are health and anti-aging. And this is a new study says how unboiling an egg leads to better cancer treatments, and the Nobel Prize of 2015 basically was addressing how you can look into the DNA and how you can help with the folding of the proteins. So we're running towards the right direction with signal research. Now, misfolded proteins look like this, and this is a nicely folded protein. This is functional, this is disease associated. Nonsense proteins, this is a nonsense protein, and this is a properly done. So this is a correct protein, and this is a nonsense protein. So you see how it stops here? So it's, let me show you what this would mean. And this one would be something like this. Okay, so you cannot, can you tell what this is? No, you cannot. You don't know what that is, right? But this one is going to be something like this, alternating frequencies forming a biolanguage. Okay? So this is the difference between a nonsense signal and a proper signal. And this is how it would look like in basically an analysis from a biochemist or a geneticist. Now, neurofrequency transmission happens two ways. One is via voltage-driven signals, and the two is via ultra-low energies. Actually, I'm sorry, but that one I reversed it here. So the number one is via ultra-low energies, and how you do it is this machine has very, very low energies, and at those energies, the ion channels of the cells are amplified, so you can pass the signals through. There's a whole book that deals with it called Electron-Gated Ion Channels that came out in 2012. Now, a second way is via voltage, and this is this device. So the voltage-driven neurofrequency signals, okay, is started with a pacemaker, and it was extended to multiple sclerosis by Jerry Potok in London University, who actually created this device. He built this device in London University. And he did it to basically replace the function of the damaged motor nerves. And this is how he did it. So this is a normal neuron, and this is the signal of a damaged neuron, and this is a neuron plus the health builder. This is what the health builder would look like, and that's the machine created for Dr. Mark especially. And that's what the neuron, a normal neuron appears, what it would go back to become a normal neuron. As you can see, this is how thick this is, and look how atrophic this is. So this one has a nonsense signal or a lot of nonsense signals. This is the correct signals. So basically, he did his research by looking at the damaged neuron and adding a device that can create the same signal that a normal neuron had. Is that clear? And this is the body that we all want. This is a slide borrowed by Dr. Filzer there. And fitness is health. We all know that low physical activity and low caloric intake will be healthy. I don't follow that, as she knows, because we have this at home. And the question is to exercise or not to exercise. This is the active exercise. This young man is there. And this is the passive exercise with the iron magnum or the health builder or the virtual gym. So the problems with exercise is effort consuming, is time consuming. There can be back pains, like after pregnancy there is a problem because some women have back pains, so they don't want to exercise. The low energy makes exercise difficult to sustain. As you're aging, your exercise, you can get injured. So again, to exercise or not to exercise? And the answer is that we have like a virtual gym that is primarily made for fitness, like the health builder is made for health. The virtual gym is made primarily for fitness, and that's our solution basically. And it makes you healthy and light and slender without the exercise. And this is what the three machines look like. This is the health builder, this is what the iron magnum looks like, and that's the virtual gym. How is it done? You basically do it with pads. We can have a demonstration right now if somebody wants to lose about 4-5 cm out their middle belly. I think Monica did it. So you did it, right? Yes, she did it at some point. And now, what happens during the treatment of a health builder inside the body? So the signal of each pad creates waves, and the motor neuron that it stimulates resonates with the motor neuron neighboring to that, and the one next to it, just like waves. The resonance wave that we saw before, reaching the brain. Okay? So basically it's a wave of motor nerve signals that ultimately reach the brain. As they reach the brain is going to respond to it by releasing the hormones. The hormones are going to run inside the body, we'll get the fat from the fat cells and start building the muscles. Okay, everybody understands that? A wave of motor nerve signals are created from each of these pads that you have on your body. All they do is they amplify, they resonate with the signal of a motor nerve inside the body. That motor nerve amplifies the signal of the motor nerve next to it, and so on and so forth until it reaches the brain. Okay? It's like a wave process. It's waves. And basically the active exercise will stimulate the motor nerve. That's what the iron magnum or the health builder will do. Will resonate with the motor brain. It's gonna go to the brain, pituitary gland. It's gonna get thyroid hormones that cause the lipolysis, growth hormones that are eventually gonna turn into IGF-1 to build the muscle. And DHEA, we have also found concentrations of DHEA that will also increase bone density, will increase collagen, and they're also going to increase the immune system. So that's where you get all the health benefits through the hormones. Endogenous hormones, stimulation of endogenous hormones. You don't need the injection from the inside. So this is some magnetic resonance studies, I think. That comes like that. You can see the before and the after. And this technology is the only technology that removes and reduces visceral fat. You cannot do it with liposuction. Lasers cannot go into the visceral fat area. Radio frequency cannot do it. This is it. It's either you go to the gym or you sit on this. Now, this is a study that we did, and we found a significant decrease of visceral fat from before and after. It was a significant difference with 20 subjects and 12 treatments. What is visceral fat? Okay, so this is the subcutaneous fat, and this is visceral fat. Do you see how it wraps around your heart? This is a healthy heart, and this is a visceral fat heart. You know, how it wraps around the heart and how it can wrap around the organs and suffocate in them. So visceral fat will shorten your life. So visceral fat will increase with age. Everybody over 40 is estimated to have visceral fat, and of course it cannot be removed with other procedures. This is it. Either it's exercise or this technology. Now, if you are an older person with visceral fat and you go to the gym and you exercise strenuously, unfortunately, you're not going to get this. Why? Because visceral fat is very difficult to remove, and it's almost impossible to do it if you're exercising. So this guy has great muscle tone, but still has the visceral fat under the muscle. And that is what this machine can help you do, basically much better than anything else. You can naturally remove the visceral fat, which is the fat that will kill you. This is Grace Wong. Everybody knows this because she was very excited about the results of this technology. And this is the before and that's the after. And that's again Grace. She is the same person, Grace Wong before and after, and she did 6 treatments. This lady did her dissertation in Poland by using the ion magnum, and these are her results that she presented. We have a distributor right now in Poland because of her, because she did it in Poland University, and a lot of doctors have been very, very interested in the technology because of the way she presented. This is from Indonesia, 14 treatments, 54-year-old. She had quite significant results, 14 treatments. And this is actually from India, from Slim Express, before and after. And this is the results. The important thing that you want to see here, that's in sonography reports, there was fatty liver, and there was no evidence of fatty liver afterwards. So that is the visceral fat. Diabetes was also significantly improved. She lost weight, obviously. And this is this patient. That's the patient. Okay? That's before. It's 20 treatments. Some people might need 30 treatments. Some people might need 40 treatments. Okay? But it will happen in the end. So it's a question of persisting. This is another case. Again, the insulin is probably the best result here, and the pain was significantly decreased, but insulin was, insulin resistance significantly decreased. So that is a very good result on the diabetic patient. And that is the patient. Actually, you cannot see, it doesn't seem so much, but if you look from here and from here, she still seems fat to me, but apparently I think she has more over here, so that's why she looks more. But there is a decrease, and she's the one that her diabetes was improved. So this is a person that the health result was much better than their fitness result. Now, we've done some, with the same study actually, we looked at subcutaneous fat, and there was a significant difference. Of course, if you remove visceral fat, you will remove subcutaneous fat. And that is just a slide with the muscle mass increase. And there was again a significant difference before and after the muscle mass increase. And